Now there are two effective, non-invasive ways to reduce double chin fat. There's cool sculpting, which you see here, that freezes those fat cells, and then there's sculpture that heats those fat cells up. Now both of these techniques cause those fat cells to die off, and then your body clears that fat through natural mechanisms. Essentially, you poop it out.
Don't wanna let you out my head.
I love that she has such a sense of humor about this. So I do have a number of patients who come to see me, and their complaint is that they have a front butt. This is a butt on the front of your tummy. And this can occur rarely, but it can occur in people who develop excess skin of the tummy. Combine that with the scar that goes down the middle of the tummy, and it makes it look kind of like a butt. So the treatment for that is a tummy tuck. And this is a surgery that I do all the time. Take a peek at the before right here and the after right here. And you can see that it does work. Now she's left with one butt instead of two.
Girl, don't do it. It's not worth it.
Already did it. Already did it.
Well, good for her. It looks like she underwent a breast reduction surgery. There are so many women out there that have breasts that are so big that they cause back, neck, and shoulder pain. So a lot of insurances will cover this operation if the breasts are large enough and if the patient has those types of symptoms. The big negative of breast reduction surgery, though, and this is something that all plastic surgeons really need to discuss with their patients before they do it, is that it creates lengthy scars. And those scars extend circumferentially around the areola, vertically down, and usually horizontally underneath the breast. These are permanent scars, and they are long.
I can't take it off. I can't take it off. Like, take it off. I can't. Take it off. I can't take it off.
This is called an external fixator. And essentially what probably happened to her is that she broke some bones pretty badly, probably her tibia, her fibula bone. And the external fixator is a way to basically stabilize those bones as they heal together. Eventually that external fixator will be removed as those bones heal well. What the hell is this? Back in the early 2000s, some doctors were performing thread lift operations where they would take threads or sutures that were barbed, run them underneath the skin as a way to lift and tighten the skin. Those sutures back then were permanent, and because they were permanent, they would cause potentially permanent problems. So fast forward now about 15 years later, and doctors are using temporary or absorbable sutures instead. And these are being used to either lift parts of the face where the results literally only last maybe 6 months, or in this situation where they're running this underneath the surface of the skin to try to create more collagen. Well, you can stimulate your collagen to get thicker without sticking tons and tons of needles under your skin. You can try using a retinol cream every night. You can take a collagen supplement like hydrolyzed collagen, and you can even try non-invasive treatments like microneedling, radiofrequency therapy. There's so many options. You don't have to stick dozens of needles underneath the surface of your skin.
Hi guys, I just want to share a Botox procedure that I did a week ago. It was injecting the wrong spot, so I ended up with a droopy eye and also a bigger eye.
Wow, her injector really screwed this one up. What is going on here? Well, the droopy eye is something that no question can be caused by Botox. When Botox is injected around the eye itself, let's say underneath the eyebrow, it can technically migrate to the eyelid, and there is a muscle that lifts the lid up. If that migrates down there, it can prevent the muscle that opens the eyelid up from working. That causes the eyelid to drop. Now, there's no 100% way to reverse that. You just have to really wait it out, and that can take a few months. But there is an eye drop that can potentially help with it. It won't lift the whole eyelid up, but it may help a little bit.
Local doctors initially tried to give him treatment for the disorder, but nothing helped. And as he grew older, the symptoms got progressively worse.
Wow, poor guy. He appears to have a form of neurofibromatosis, and these are growths, typically benign growths that occur in nerve sheaths. It can cause multiple growths like this to occur all over the body. Now, you can actually excise some of these. These can be removed surgically. The problem is just because you remove some doesn't mean that they're not going to grow back. Unfortunately, there's no cure for it. It's a genetic condition, but surgery can help to alleviate symptoms. So for a guy like this, where he says, geez, at times I can't really see, even though he may grow some of the lesions back, I would probably recommend cutting them out so at least he can see, he can eat, and hopefully even feel better about his appearance. It's a tough problem. This appears to be a keloid. A keloid is a scar that has grown outside the boundaries of its original scar. It most commonly occurs in areas of joints and where you've got a lot of tension. So high risk of keloids in the shoulder, in the knees, in the elbows, and for some reason in the sternum or the middle of the chest, and weirdly enough, in the ears. The treatment for a keloid like this would be to cut the keloid out, but because there's such a high incidence of it coming back, you also want to do other things like pressure earrings, where you can put pressure on the ear where that keloid came from to hopefully help prevent that thing from growing back. This episode is brought to you by my skincare line, Youn Beauty. Our products combine natural and organic ingredients with the latest in scientifically proven anti-aging components like vitamin C and retinol. So if you're looking for healthy and youthful skin without the unnecessary chemicals, this is the skincare line for you. Check them out at dryounonline.com and use the coupon code 20OFF to get $20 off your first order over $99. We'll put a link in the caption below. All right, back to the video. Well, that is quite a change. Now, I don't do rhinoplasty surgery anymore. I did it for, maybe 15 years. So this is surgery I've done a lot of. Quite often, plastic surgeons make their nose jobs all look the same. And there are certain doctors where you can actually spot their rhinoplasty results like from a mile away. So the big take home from something like this is if you're gonna have your nose done, make sure that you and your doctor have the same outcome in mind. If you're thinking that one thing looks good and they're thinking that another thing looks good, that could be a big problem.
You can stop. It is never too late. I stopped after I had a whole hole in my nose. This hole will not go away. Do not do cocaine. That is a horrible drug. Now don't do it.
There's a lot of truth here. If you snort drugs, it can actually decrease the blood supply or vasoconstrict the blood vessels leading to the septum. And the septum is the cartilage that separates your two nasal airways. And if that blood supply has been cut off for a long period of time, if you keep doing those drugs, you can develop a hole in it because that tissue can literally die from lack of blood supply. Well, if enough of the septum dies off, then what can happen is your nose can literally collapse. There are celebrities whom this has happened to.
Did you know that 90% of the bacteria in those little probiotic pills that you take actually die in your stomach acid? The way around this is to take your probiotics before, during, or within 30 minutes after your meal. That way the food reduces stomach acidity, so it's less acidic and those bugs can make it to where they need to go. Hope this helps.
Jen Fugo is a friend of mine. She's a nutritionist and she helps thousands and thousands of people with their gut issues and their skin issues as well. And this sounds like it's good advice. Probiotics are beneficial bacteria for your gut microbiome, and I think that they are great for your overall health. They're actually really good for your skin. And if you're on antibiotics or you've been recently on antibiotics, that can also potentially help with your gut flora as well. Wow, I'm really glad that she shared this video with us. And if you look closely, and feel free to rewind that and watch that again, you can see the life kind of come back into her eyes as she has hopefully gotten away from this situation. Domestic violence is something that is insidious in our society, and there's so many people who are victims of it, who are suffering with it, who are surviving through it, and they are not really heard from. So if you are in a situation where you do not feel safe, please, please, please reach out for help. Call your local police or go to your local hospital where you should be able to get help. Now, one thing that I'm really proud of is that my skincare line, Youn Beauty, every quarter we give a percentage of the profits to a local domestic violence charity called Haven of Oakland County. And if you've purchased Youn Beauty skincare, I want to thank you for helping me to support them. So every time I react to TikTok videos, I always end off by showing two of my own. Let's see the first one. It always shocks me how many women and men undergo plastic surgery and they don't tell their spouses. I actually had one woman have a facelift. This changes the shape of your face, changes your look, while her husband was on a business trip and gone for like a week and a half or something. And I told her, like, there's no way that he's not gonna know she had a facelift. And she said, watch and see. And when she came back to see me 2 weeks after her surgery, her husband never figured it out. So are we all set for the tummy tuck? Yes, I'm excited to get it done, Dr. Youn. Wait a minute. What about the, Is there something else? No, Dr. Youn, I'm good with the tummy tuck. Wait a minute. Remember what we talked about? Yes, and I'm good. You were gonna ask about implants. I don't want implants anymore. But I do! I want implants! Oh, you do you? If you were to ask me what is the thing I hate worst about being a plastic surgeon, it's whenever I encounter somebody who tries to coerce their partner into getting plastic surgery. It doesn't happen all that often, but I really, really hate it when it does, and I would love for something like this to happen to them. Not really, but we can all hope, can't we? Now, I react to some more crazy and hilarious TikToks on this video right up here. Click on it and check it out, and you're gonna have some laughs with me. Thank you so much for watching my channel. And if you've been enjoying my videos, please subscribe to my channel. And always remember, eat real food, use clean skincare, and always consider actual plastic surgery as a last resort.